Back with Dr. John Kressel of Phoenix Cyberknife. He is answering viewer questions, and in the break, you had a very unique email come in.
Yeah, we're trying to make ourselves available, so I had a physician from Yuma that we've worked with who emailed me about a patient, so we got a patient referred who is an appropriate candidate. He had some questions, and we'll be seeing that patient this week.
Oh, there you go. I mean, we were talking about that in the last segment. You guys are revolutionary. You're fairly new, so a lot of people don't know that you're out there. So a physician reaching out via email between your first and second segment, that's fantastic. I want to get to some viewer questions, and this question came in. How long will my consultation last, and will I meet the doctor?
Absolutely. So usually a consultation lasts about an hour, sometimes two, depending on how complex it is. Because again, the Cyberknife can actually afford a patient an opportunity who's been told that there is no treatment option for them. So those complex cases take longer, but it's an hour. And yes, you will meet one of our physicians who specializes and trained in radiation therapy and radiosurgery with Cyberknife.
I can only imagine when they get to you, it's just a lot of questions, probably not even realizing what's going on. So just meeting and having a consult is wonderful. We got another question from a viewer. How long does the treatment take?
So if you're receiving a radiosurgery treatment, it's sometimes just a single treatment, which can usually last anywhere from 30 to 60 minutes. But all of the treatments are done in a week or less, and usually is only 30 to 60 minutes as an outpatient. No needles, no anesthesia, nothing like that. We routinely treat patients in the morning who go golfing or shopping in the afternoon.
So it's non-invasive, and it doesn't hurt?
There's no pain. You don't feel anything. You don't see anything. Nothing touches you. It's all directed with image guidance, and it's directing the radiation beams in a very precise way.
And not all over, which a lot of times, people say that happens. So
safety is an important issue. Absolutely.
Okay, and our third question, how long have your physicians been in practice?
So our group's been around for more than 20, 30 years in the Valley. Our physicians have been board certified and practicing for anywhere from 5, 10, 15 years. We actually are training other physicians in radiosurgery and Cyberknife and publish on that. So we're helping trying to raise awareness and educate other physicians as to how they can offer these treatments for patients.
I hope this question isn't too broad because we only have about 30 seconds, but what is the difference between radiation, which is one of the alternative treatments for cancer, and what you all do?
So radiosurgery is part of the continuum of radiation therapy. It's the treatment that's being delivered in a more precise fashion. So radiation therapy has been a cornerstone of oncology treatment for decades. And as it advances, so does our techniques. And this is the most advanced technique in radiation therapy, allowing us to remove or limit the radiation to surrounding normal healthy tissue and pinpoint the areas that we need to treat, giving us the chance to limit side effects and increase the dose to the tumor and increase our cure rates.
Alrighty, if you've got questions, and undoubtedly you probably do if you or a loved one has cancer and you want to get your questions answered, visit the Phoenix Cyberknife and Radiation Oncology Center. They are located at 4611 East Shea Boulevard. You can give them a call at 602-441-3845. And as Dr. Kressel said, you can call them and they will actually consult with you over the phone. The email address is phoenixcyberknifecenter.com. We appreciate you.
Thank you, Susan.